many of you know what a naturopath is? Raise a hand. Okay. How many of you know what a doctor of naturopathic medicine is? How many of you knew that there was a difference? Okay. I did not until the last year, maybe. Okay, our next two presenters are from the National University of Health Sciences. I'm going to go over each one individually. Dr. Tursha Hamilton is trained as a family care physician who treats both acute and chronic conditions, but her passion is for treating diabetes, obesity, and GI conditions. Dr. Hamilton also has a degree in naturopathic medicine, so you get the best of both worlds with her. She has authored or co-authored 5 books. I have one of them, and it's excellent. She's posted weekly radio shows. She's currently clinical and adjunct faculty at the National University of Health Sciences. Dr. Fraser Smith is the Assistant Dean of Naturopathic Medicine and Professor at National University of Health Sciences in Lombard, Illinois. Prior to working at National University of Health Sciences, that's kind of a mouthful to keep saying over and over again, isn't it? He served as the Dean of Naturopathic Medicine at the Canadian College of Naturopathic Medicine in Toronto and Ontario. Dr. Smith has authored several books, including the textbook Principles and Practices of Naturopathic Medicine and the book Keep Your Brain Young for Patients. He is currently president of the Association of Accredited Naturopathic Medical Colleges. His focus area is naturopathic medicine. In naturopathic medicine is botanical medicine and the pharmacology of plant extracts. Please welcome Dr. Hamilton and Dr. Smith.
Thank you. Good morning, everyone. Very nice to be here. Gracie, thank you for inviting Dr. Hamilton and I to this wonderful event. Some people in our clinic and in my life suffer from chronic pain, and I think it's absolutely wonderful that we have so many resources together in one place for all of us to learn. I'm a naturopathic physician. What we're going to do this morning in our time is talk a little bit about our approach to chronic pain. I'm going to start off talking a bit about some of the natural therapies per se, and Dr. Hamilton is going to continue that. One thing we're going to focus on is our naturopathic model, which really looks at the underlying function or physiology of the body. So in other words, one of our key principles is to treat the causes as much as possible, or to try to get at root cause of things. And this concept, determinants of health, which you see up on the screen, Dr. Hamilton will expand on with you. So the take home is there's a lot of therapies that can be very helpful, but there's some underlying causes that we want to get at with chronic pain and a lot of the other chronic conditions that we see at our clinic. We've dropped in some research and references and things in these slides. They're at a density and a font where they're not really up here for you to read from the seat, but maybe for further resources, because we wanted to pack in as much education as possible. I'll just take a few minutes to talk about our approach. I saw from the show of hands that not everyone here is familiar with naturopathic medicine. It's a distinct type of primary care. We're licensed in 19 states as primary care providers in most of Canada. It involves diagnosis. The main focus, though, is trying to recreate the conditions for health with people and to use natural interventions. So this idea, going back to the Greek physician Hippocrates, that there's very strong repair forces in the body, but they become blocked, or they're not properly nourished, or they've become confused, and we really try to work with that. We're very well trained also to know what we cannot manage, to refer to other types of physicians, medical doctors. So it's not a either or type of choice, but that's our basic approach there. Here's our basic principles, which I really see in our clinic as principles in action. So it's not just a nice philosophy that we have up on the wall, but really how we try to practice. So trying to really teach people what to do in between office visits, or what's really driving their condition. Try to treat the whole person, whole systems, and this is what we find to be effective. So here's the dark green, not the darkest green, but the sort of aquamarine areas here on this map are where our profession has grown the most, but it's growing very quickly. Pennsylvania and Massachusetts just enacted licensing laws for naturopathic physicians in the last 6 months. So obviously there's a growing demand for that. And this is where people who want to become a naturopathic physician study. It's 4 years of medical school. After obtaining a bachelor's degree, there's licensing exams, etc. Some of us do residencies. So our school here, technically in Lombard, Illinois, is really the only one in the Midwest. And the therapies that we'd use are quite predictable, based on our orientation to practice. So, of course, lifestyle counseling, which Dr. Hamilton will get into, I think show you why that's so important to us. Clinical nutrition, botanicals, which is my specialty, homeopathy. Some of us do acupuncture, although not in every jurisdiction. And physical medicine, which can be anything from hands-on soft tissue work to something like spinal adjusting or manipulative therapeutics, as it's sometimes called. So in some jurisdictions too, we can do things like suturing, intravenous therapy, which is a great way to get antioxidants and nutrients into the body when someone's very depleted. And in many of our states now, we can prescribe most family practice drugs. We choose not to. But in Vermont, where I happen to hold a license, but actually, my wife would sort of like to move there some days, I think, but I could prescribe most family practice drugs. But our orientation is to start with less invasive things. So one thing I want to point out to you is there's a lot of herbal extracts. Don't worry about reading the fine print here, but things like quercetin, which is flagged in this article, reducing inflammation in the brain. Quercetin is a bioflavonoid, as it's called, and you would find it in fruits and vegetables, especially onions, but many other things too. A lot of plant extracts can enhance cognitive function. So Salvia officinalis, otherwise known as sage, has been found in older adults to increase memory, performance on mental status exams. It's not a out-and-out standalone cure for advanced dementias. I'm not implying that, but there's anti-aging things. And I think in chronic pain, if we're looking at the whole person, one thing we want to really focus on, and we do in Lombard, is how quickly is the body aging, how much stress is it under, and how much inflammation is there. I typically find this to be very accelerated in people with chronic pain for a number of reasons. Just the stress of having to get up and fight through another day with extreme pain sets up a lot of hormonal and endocrine events going on that put the body systems under extreme stress. And something as simple as sage, actually a lot of the things in our spice cabinet are good for the brain, but something as simple as sage has been scientifically found to really help with that. Here's something I wanted to point out to you, and what I'm doing here is just a little survey of some of our favorite plant extracts. Now, I would predict that of everyone in the room who is here for themselves primarily, about half of you would probably benefit from this. The other half, it might set things off, which again comes back to this principle of individualization. What works for one person at one point in time might not work for them 4 years from now, or might not work for the next patient to come through the door. Capsaicin is a heat-producing substance. Those of you who like chili peppers are pretty familiar with capsaicin, right? It has been known for a long time topically to reduce pain. And in the 90s, I remember patients actually bringing it and showing me arthritis gels with capsaicin in it. And they are 0.025% capsaicin. So that's the actual hot compound. Now, we always knew that it depleted something from nerves called substance P, which was a pain activator. It turns out it's a lot more interesting than that. Now, this therapy, this is from the British Journal of Anesthesiology. This is a medical therapy, really. They use this, it's a FDA-approved substance, actually, Quitensa. It's a capsaicin patch, but it's 8% capsaicin. So this is a much bigger deal than the gel. This is extremely potent. The nurse has to wear a mask. The patient has a sheet between, the lower part of their body and their breathing. It's extremely strong. And what they found is a lot of the patients, I think the patients in this study were diabetic neuropathy, which is just one kind of chronic pain, but it could be a very severe one. They had very significant relief for about 3 weeks, 3 to 4 weeks. So one thing they found about capsaicin is that it does more than just deplete substance P. So it's more than just numbing you out for a few hours. It actually, what they call defunctionalized, really put to sleep some of the pain receptor nerves. So the nerves that take sensory input, bring it up to your brain, which, for some of us, really amplifies any kind of pain signal. It turned it off, didn't kill it, didn't hurt it, just really defunctionalized it for 3 or 4 weeks. It doesn't last forever. And obviously these were parts of their body where a certain amount of capsaicin could penetrate, but obviously an in-office type of therapy. But this is very exciting to me because something that really has no impact on quality of life other than just giving up an hour to sit there and get the patch could have such long-lasting effects for people. Here's a typical supplement we might use along with other things, especially looking at specific conditions for life, special determinants of health. But in terms of supplements, this is a very common type of supplement for us. And if you're, looking at natural things that you can use, you're speaking about them with your medical doctor or you're seeing a naturopathic physician, you want to ask questions about these things. But this is a very typical formula. So you'll see that along the right-hand side there's some ingredients. There's curcuma longa extract, which is turmeric, a very common supplement these days. It has anti-inflammatory properties. So it reduces inflammation. Unlike something like ibuprofen, it doesn't hurt the stomach, it doesn't cause bleeding, and it does much more than that. It heard a very good presentation already today about genetics. Some of the compounds in turmeric bind to the nucleus of the cell, actually cause change in gene expression in terms of how inflamed our body is. So it's very common in our clinic to recommend this. Bromelain, which is an anti-inflammatory enzyme, is in there. Boswellia. Serrata is an herb that's also pain relieving and anti-inflammatory. Very, very roughly could say it's like a natural aspirin, but it very, very safe. And it doesn't cause the GI bleeding that we worry about with something like ibuprofen or Motrin. Quercetin is in there again. So while we look at causes and conditions, we often use something like this for people to help just bring inflammation under control. Now, in terms of direct influences on pain, there's many, many herbs with sometimes centuries or even millennia of history of use for pain. Salix nigra, or black willow bark, is a very good soft tissue pain remedy. Of course, aspirin is a synthetic derivative of willow bark. It's modified to be more absorbed more rapidly into the bloodstream. Can also have that effect of enhancing bleeding. The herbals are a lot safer than that. It actually goes back to Egyptian medicine, certainly Greek medicine. So people have been using tea made from willow bark for 5,000 or 6,000 years at least. Jamaican dogwood is more sedating, more potent pain relief. It's a bark, and it is like willow bark, but more likely to make someone feel tired. And then St. John's wort, which a lot of you have read about, certainly has antidepressive effects, but traditionally it was used for nerve pain. So burning, throbbing nerve pains, that was its traditional use for hundreds of years. And while it certainly can impact mood and help get people out of a depressive state, there's a lot of research supporting that, excellent quality research actually. It's more than that. That's often the way it's marketed, but it's a very good nerve remedy. And then passion flower, which is one of my favorites, is a fantastic herb for people with sleep disruption because of anxiety and pain. Now, with all of these, it's always worth going through whatever medications you're on with a physician before starting one of these herbs. I know that sounds like a blanket disclaimer, but it's true in the case of a lot of pain medicines. And the problem is some herbs and some drugs happen to get broken down by exactly the same proteins in the body. So if you're taking too many of both, it's sort of like a very crowded checkout lane at the grocery store, right? If you try to get that, that head of romaine lettuce at Jewel at 12 after 5 in the afternoon, it can get frustrating because you're all lined up. That's what begins to happen. And it can change the way the body reacts to a drug or an herb. So fortunately, we can predict a certain amount of that because we know how these things are broken down. So in our clinic, if somebody comes in, if they're on Lyrica and maybe an opioid or something like that, we can run that drug and whatever herb we want to give through a interactions checker. So it's a database. Pharmacists often have these too these days because Walgreens, et cetera, sells a lot of herbals. And it doesn't completely tell you what's going to happen, but it can give you a very good insight into what might happen, or to give us reassurance that, this willow bark plays really well with the drug that you're on. Let's not get too worried about it. We'll keep an eye on you. And so natural remedies and pharmaceuticals can be compatible. You just have to know, what someone's taking and take a good look, because I think going back a few slides, one of our principles is first do no harm. So the last thing we want is for someone to have an herb-drug interaction. So this is kind of what we're saying is, the pathways do matter, and that's something we would research for the patient. Another useful antioxidant to know about is something called alpha lipoic acid. It is what's called an antioxidant, which absorbs, you might say, loose electrons in the body, which are present when there's a lot of inflammation, present when our bodies are dealing with a lot of toxins, which is most of us. It seems to be very helpful for peripheral neuropathy. So anybody who's had damage to nerve from spinal stenosis, spinal surgery, trauma, accidents, crush injuries, anything like that, and diabetes, any kind of metabolic issue, it seems to help. It seems to protect nerves, and it seems to also support the power plants of our cells, which are known as the mitochondria. This is where really oxygen that we breathe gets combined with energy, pure energy from food that we eat. These mitochondria are like miniature power plants in the cell, And alpha-lipoic acid is one of the things, along with magnesium and other substances that can help support that. A lot of people with, interestingly, chronic pain, fibromyalgia, depression, and heart disease all have impaired or depressed mitochondrial function. So that sense that they have of wanting to turn the ignition in the morning when they get out of bed and nothing happening, that's not all purely psychological. That is true at a cellular level for many people, that their power plants are just not firing up, and that could be a side effect of drugs. That could be certainly a nutritional issue. It kind of comes with the territory of living in industrialized worlds where a lot of our nutrients get spent breaking things down, breaking down a lot of compounds. By industrialized, I mean since the Second World War, about 90,000 compounds that never existed before have been patented and put into common use. So we're all, if you didn't know, we're all part of an ongoing uncontrolled experiment to see what happens with that kind of exposure to all these new compounds. Some of us are more sensitive to others than that, and our metabolic pathways are breaking down little sooner than the rest of the population. I've had some patients describe themselves as the canary in the coal mine. In other words, they feel like what would make their neighbor sick after 5 years got to them after 6 months. And this is a very real thing that's been on my mind a lot lately. Is one of the first things that interested me about naturopathic medicine was just the simple idea of detoxification. So St. John's wort, these are really just here to spur some future reading for you, or something maybe even to discuss with your caregiver. I know in Phoenix, Dr. Hamilton did a lot of intravenous therapies. I used to do it in Ontario, and vitamin C is one of the most common things which can really give people a boost. We'll hear later today about the endocannabinoid system, and it's been delightful to me to see the growth of use and research and benefits in cannabis derivatives. It's also amazing, as a guy who got involved in natural medicine in about 1990, when most of my friends thought, you know, I'd been abducted by a cult and was going to be like becoming a professional shaman, which wouldn't be that bad a vocation, actually, but to actually see that a plant medicine is becoming a blockbuster in medicine, and rightly so, because it's benefiting, the various compounds are addressing the body in a very, very fundamental way. So it's interesting to see that the return of plant medicines into medicine is very exciting. There's different receptors for these cannabis derivatives, and it seems to be a very primordial, fundamental survival mechanism in the body, a repair and damage controlling mechanism, which we just call the endocannabinoid system. One of my interns, Leanne, who's here today, has been helping me a lot with some of this research. And these compounds, it's no accident that they can strongly change seizure activity, pain perception, help people with cancer who are, you know, their health is in a downward spiral, because it's impacting the body at such a fundamental level. So we definitely, you know, as I said, individualization is very important. We ask a lot of questions in naturopathic medicine. It can be a very long first intake, but we really do want to know through lab work, a history, a physical exam, a medical history, who our patient is. You know, the physician William Osler, who was considered the founder of modern medicine, if you will, said, I'm much more interested in the patient who has the disease than what disease the patient has. Of course, he was a master diagnostician, but he understood that at the bedside, everybody's different, and you have to choose your therapies accordingly. You can't lump everybody together. Communication is important, and I'll sort of end with this before turning it over to Dr. Hamilton. I've seen a couple surveys like this, one in neuropsychiatric care and just general medicine too, about a third of patients who were using alternative medicine, natural medicine, did not disclose this to their physician, their medical doctor. So if you think about all of the opportunities for herb-drug interactions, that's a little disconcerting, right? Why? Well, they didn't want to get them riled up, they're disapproving, et cetera. But it's very, very important. My feeling is if a physician can't support you in making the choices that you need to make, maybe get a different physician, right? So we should not... And that applies to, finger-wagging naturopaths that might say, hey, don't use a medical therapy. It's the best of everything that people need. So full disclosure is very important. Dr. Hamilton will talk a little bit more about the determinants of health. And I'll just sort of close with saying we're very interested in finding causal factors for our patients. So it's not a one-size-fits-all approach. There's many gateways that lead people to a state of extreme pain. And I'll bring this up to the point. We've tucked in some extra pharmacology info for you in the thought that this is something you might want to delve into more. Those of you getting physical medicine, I take a particular look at the Neurodevelopmental School from Prague in Europe if you're not getting anywhere with physical medicine. All right, I'll welcome Dr. Hamilton to the lectern.
Hi. So I am Dr. Tursha Hamilton, and I am really, really, really excited to be here. I wanted to talk about the determinants of health because I feel that they're so very needed. Basically, in naturopathic medicine, when we talk about the determinants of health, we're talking about those things that are necessary for you to have on board so that your health can be optimized, regardless of the type of physician that you're going to, or the type of treatment that you're going to. These things need to be on board for your body to heal and to heal optimally. So if these things are not there in adequate numbers, generally you won't see healing as well as you could if it's on board. That's not to say that these things will heal you, but they're very much necessary for that to happen, all right? So I wanted to talk about a few of those things, and I hope I'm using this right. Yep. So a few of the things that I'm going to talk about: mindset, hydration, sleep, exercise, nutrition, relationships, laughter, breath, elimination, and taking breaks. All of which you've heard of before, all of which you've probably heard in a news report coming here or on some show, but I want to talk to you about how it's more relevant to your health actually, all right? Mindset. First things first. I am starting to advocate that everybody get therapy. Every single person. I have to admit, I've been advocating it for a couple years and I just started myself. So, yay, thank you. And I say that because just in life in general, most of us have not really learned how to handle day-to-day life, traumas, accidents, disappointments that come up. And because we haven't learned how to handle those things, they take effect in our body. They make our bodies cause chemical reactions that are not necessarily the most positive. Now, if you add that onto a chronic condition, especially chronic pain, which messes with your mind. I'm sure many of you already know that, and if you don't, you will, right? A lot of people also identify with their condition. Dr. Smith just mentioned the quote talking about learning the patient that has a condition as opposed to what condition a patient has. And that's very much what we're talking about. If you have since lost your own identity in identifying with your condition, you might want to consider talking through that so that you can gain your own identity again, because that's important as a part of the healing process. And then coping. My goal is to get everybody to be 100% healthy. Is that a reality? Not for everyone, but that's always my goal. But we want to have somebody on board that will help us to deal with every stage of our health or our dis-ease, okay? So mental health, mindset is also important. Mindset, staying positive. We actually just had a student that did a presentation on the advantages of having a positive mindset and how some people who had positive mindset went through the same therapies but had a better outcome in their treatment. So mindset, therapy, coping, acceptance, all of these things are extremely important, and these are things that you can actually start on your own, but I would also advocate getting someone on board that will help you learn how to cope with these things better. Hydration. We already know you're supposed to drink a bunch of water, right? How many glasses of water are we supposed to drink every day? At least 8. You know, we hear half your body weight, we hear 8. So something more than the 1 bottle that most of us drink, if that, right? Right? Right. So the reason why hydration is important, especially when we're talking about pain, is because if someone is dehydrated, it impairs their cognitive performance. You can't think when you're thirsty. And oftentimes we don't realize we're thirsty. Sometimes we think we're hungry, so we eat. We're not satisfied, so we eat some more. A lot of times, if you just drink some water, get adequately hydrated, your hunger goes away. You can think better. You can rest better. You have more energy. Enhanced pain. If your body is dehydrated, your pain levels can and probably will increase because you don't have enough water on board to do all the daily things that you're supposed to do. So in order to help your body handle pain better, you want to make sure that you're properly hydrated. Now again, a glass of water may not decrease your pain, but staying hydrated regularly will have your body working optimally. And increase pain perception. Those people who do have pain and they are dehydrated tend to perceive a greater level of pain than those who are hydrated properly. All right, so that's hydration. So the bottom line is drink water all the time, right? Drink some water. And luckily they just brought bottles in. Yay, how convenient. Sleep. Sleep is tricky. If you're in chronic pain, it's often hard to sleep. But if you don't get some sleep, you cannot repair. Catch-22, right? So I wanted to talk a little bit about why, specifically for you all, pain is important. Sleep is important. If you don't get adequate sleep, again, you cannot think. Have you guys actually had an all-nighter or 2 in a row, and then you were loopy the next day? I see a couple hands up. Thank you guys. Right, today, right? It increases depression. If you have chronic pain, if you have chronic illness, if you are just in a bad mood and you don't get enough sleep, you are more depressed, you are more irritable, you are crankier, you're not as big a ball of sunshine, right? And then people leave you because you're not the ball of sunshine that you normally are, and then you get depressed about that, and it's a vicious cycle. So sleep is important to help elevate your mood, even in a chronic pain cycle. And it decreases your pain threshold. So if you get enough sleep, then your pain threshold will decrease. Now, I was about to say something profound, and it just left. All right, here it is. I got it. So if you think about it, if any of you have had children or seen children, you know that when they go to bed, they wake up the next morning, they're like 3 feet taller. Parents, have you noticed that? Like every other day you have to buy some new shoes? Right, thank you. And so the whole reason behind that is because the time you sleep is the time that your body heals and repairs. So just like the child that's growing while they're asleep, your body is doing the same thing inwardly. It's taking that energy to actually heal your body. So if you do not get an opportunity to sleep on a regular basis, you are chronically without sleep, your body cannot heal as well. So we have to do whatever we need to do in order to get you some adequate sleep. And so that might be medications for some. That might be herbs like passiflora. That might be meditation, whatever that is for you, or a combination to start to get adequate sleep. Exercise, movement. Now, I realize that everybody can't hula hoop. Those people who have chronic pain cannot necessarily hula hoop. But my point here was that exercise and movement is important. Move your body. Whatever that means for you, if that means tango, if that means walking around the block, if that means getting on a trampoline or one of the smaller trampolines that you can do in your house that can help move lymph around and get things flowing, you have to move your body. We live in such a sedentary society that oftentimes we're not moving, we're not doing our bodies any good. Movement helps to increase blood flow. Get all the good stuff to all the cells, take all the trash out of the cells to get it eliminated from the body. It increases your sense of well-being. It increases your lymph flow. Lymph is like that other blood system without blood, but it actually has a lot of your immune system in it, and it just basically helps to take all the fluid that's in the body and drain it back into your blood system. But those things are important, right? You have to move your lymph, and it helps to strengthen your bones and your muscles. Oops. Nutrition. I can talk hours about nutrition. I won't, because you probably don't want to hear it quite like that. But nutrition is extremely important as well, because if you eat poorly, you are increasing your inflammation. There is no doubt about it. If you're eating the things that your body does not like, want, or need, you will be increasing inflammation. Many people out here now are already taking anti-inflammatories to help decrease their pain. Part of that can be alleviated by changing what you eat, learning what it is your body needs and wants, and what your body does not want. Even those good foods sometimes can be bad for a particular body. This is, again, what Dr. Smith was talking about with respect to individualization, okay? So there's the inflammation, poor cellular function, decreased elimination. Basically, the cells of your body cannot work as well if you don't get the nutrients that you need. So basically, food is a big bunch of nutrients, a big bunch of chemicals that you break down and use those chemicals on a cellular and biochemical level. If you don't have the proper nutrients on board, the cells, the biochemistry cannot act the way it's supposed to act, okay? So that's why nutrition is important. And who doesn't want to be like a bunny? Like, you want to have the bright fluffy hair and the bright eyes and the energy and bouncing around. Like, who doesn't want to eat like a rabbit to be like a rabbit? Supportive relationships. You have to have a team. You have to have a team. Get your team together. I know many of you do have a team, a healthcare team together. Start adding more people to that team. So whether that means a naturopathic physician or an acupuncturist. I was talking to somebody earlier today who was adamantly opposed to needles. Trust me, they're not as bad as our minds tell us, right? An acupuncturist or an herbalist or a physical therapist or a chiropractor, all those people, your therapist, can be and should be on your team. You want to also get supportive friends, not those negative people, not the people that gossip all the time. And if you are that person, please stop. It's not helping. It's not helping at all, because it brings people down, right? So you want to make sure that you have supportive relationships in your life so that you can be less depressed, so that you can have more enhanced well-being, and so that you can be less stressed, right? Because all of these things, if they're not optimal, they will help to increase your pain, decrease your mood, and further your disease process. Laughter. That little kid always cracks me up. Just that one tooth is always awesome. So, have you guys ever heard of laugh therapy or laughter yoga? Has anybody, how many of you have done it before? Only a few. All right. So basically, it's a group of people. I was about to say silly people, but I won't. But yes. So it's a bunch of people who get together and they laugh. They talk about different things. And it's like, all right, this situation, and you're in this situation, and now you laugh and you do this thing, right? And so at first it seems kind of silly because you're like, ha, 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 ha. But eventually, like, it's a room of people who are ha, 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 and you start to laugh, right? Laughter can heal. Laughter can absolutely heal. Again, everything is a biochemical change in your body. So the more you laugh, the more biochemical changes, the more endorphins, the more of those good chemicals are being produced within your body that promote healing. So laughter is good. It also relieves stress. How often were you upset with somebody and you were like, I don't want to talk to you? And they made you laugh, and you were mad because they made you laugh and you couldn't be as mad at them anymore, right? Same thing happens in your life. Laughter decreases stress. It, again, releases that feel-good hormone. It can reduce pain. It can improve sleep, and it can boost your immune system, all of which we all need, especially in the environment that we're in today. We need all of those things. So go out, rent your favorite movies, laugh at your favorite jokes, call your favorite cousin and reminisce about something silly that you guys did as a child, build that support system and laugh. Proper breathing. Most of us do not breathe well. How many of you took a deep breath just now as I talked about breathing? Exactly, which means that most of us are probably not breathing the way that we should. We should be breathing from our belly, using all of our lung space. Most of us are using the lung space here. Our lungs are here. So we need to be using all of it. We need to be getting good oxygen into all of our lung space, getting rid of the old CO2, carbon dioxide, and relaxing. The faster we breathe, the faster our heart rate. If you slow it down, you have a domino effect within your body to help increase relaxation, to decrease pain, to decrease anxiety. I know of people, have you guys heard of hypnobirthing? Hypnobirthing is basically a study, a form of education where a pregnant mother is taught how to breathe during the birth process so that she doesn't experience the same level of pain. And I know of people who have done it and they didn't need any medications, they didn't feel any pain. Now, I don't know if I'd be that person, but the fact is that I know it's available. And the fact that it's basically mindset and breathing that helped a woman give birth to a large child and not feel pain, just pressure, I think is amazing. So those are some of the things that proper breathing does. And elimination, I talk about poop all the time. Most people are not comfortable hearing and talking about it, but it's very necessary because most of us are not eliminating properly. So on the left, you have the woman that's just looking in the closet with the messy room. So when I say elimination, I mean all elimination, clearing the junk from around you. If you notice that your car, your desk, and your home are all cluttered, think about what's going on in your mind. Oftentimes, if my car, my house, and my desk are cluttered, I have clutter in my mind. I have chaos in my mind. I'm not thinking clearly. One way that you can help that process along is to start by physically cleaning up your space. That will allow your mind to start being more clear. I don't know how it works, but it actually does. So if you notice that you have clutter in your life, please consider decreasing clutter in your space. And poop. Think about this. If you don't take the trash out in your home, what does your house smell like? Right. Flies, garbage. You have to put it somewhere so it ends up being on the counter and on the floor because you couldn't put it away properly. You have to eliminate the things out of your body. If you want to feel less pain, if you want to have more mental clarity and all those things, you have to make sure that you are actually emptying the trash within your body and not just in your space. And then taking breaks. I read a couple studies that said that 95% of doctor's visits are stress related. And over 60% of the illnesses that we have now are either caused by or exacerbated by stress. That's a lot. That's a lot. So that means that if we learn how to manage stress by breathing, by drinking water, by eating the foods our body likes, by going to therapy, by getting sleep, how many of our medical conditions could be eliminated or at least reduced? You have to learn how to take breaks. I call them take daily vacations. I wish I could go to Maui every day. Can't happen, but I can look at a picture of Maui and mentally check out and be in Maui or Hawaii. And there are studies that prove that doing that helps your body to heal, helps put you in a different place, makes you happier. And because stress increases pain, if you can learn to manage that stress better, you can learn to decrease your pain by just decreasing the amount of stress in your body along with all the other things. So, in conclusion, learning how to take care of yourself is very important. I want you to be empowered to not just go to your therapists and your physicians and your surgeons to take care of your condition, but you have to know that you have a lot to do with it. And the more of those things you can get on board, the better you can be, the better your nervous system can be, the more you can decrease your inflammation, the more you can decrease your pain. And I believe that's it. That is it. So thank you all for having us. I appreciate you. We appreciate you.